Hello and welcome. This is Healthy India and I'm your host Lottie Alaric. Well folks, today's episode is going to be dedicated to oral health. Now this is something which is very important but is most often neglected. And for all you know, the condition of your body could actually be seen by the state of your teeth. And so to tell us more on oral health, I have in the studio three eminent doctors. And I'm very happy to have with me Director, Principal and Professor Dr. Mahesh Verma from Maulana Azad Institute of Dental Sciences. Thank you for being here. Then I have with me Professor and Head of the Department of Oral Medicine and Radiology, again from Maulana Azad Institute of Dental Sciences, Dr. Sunita Gupta. I welcome you to the show.
Thank you.
And to my left, I have with me Chief of the Center for Dental Education and Research from AIIMS, Dr. O.P. Kharbanda. Welcome to the show. So folks, before I start asking any kinds of questions to my panelists here, let's all take a look at this report.
Oral health means more than just an attractive smile. It's a reflection and an essential part of total health. One who has bleeding gums or decaying teeth can hardly be called healthy. Oral health refers to the condition of teeth, gums and the mouth as a whole. In our country, unfortunately, oral health is at a discount. Vast segments of our population suffer from tooth decay, gingivitis, periodontitis, pyorrhea and even mouth cancer. Accumulation of plaque and tartar around the gums often go unnoticed and lead to painful conditions later. Many systematic disorders have been identified as contributory factors, as has also been the role of certain classes of drugs that lead to or aggravate gingivitis and periodontitis. And then there is a role of the things we eat. It is recognized that starchy foods, sugars, soft foods and refined foods also predispose one to dental ailments. Perhaps a little more care in this regard and a little attention to oral hygiene, regular brushing of the teeth and visits to the dentist could go a long way in ensuring that our breath remain fresh and our smiles captivating.
Well, I'd like to start with you, Dr. Mahesh Verma, that when we talk of oral health, what are the basics that should be kept in mind in order to have a healthy mouth?
Oral health normally everybody perceives to be just the clean teeth.
Correct.
I think it doesn't end there. In fact, that's just the beginning. Because, oral health, when we say oral, that means mouth.
Correct.
Entire mouth. And many of us are not aware that mouth has so many other areas which are also taken care of other than teeth. That includes floor of the mouth, gums, your palate, your tongue, and your cheeks, inner part of the cheeks.
Right.
In Ayurveda and in our traditional medicine, people used thumb to clean the palate. Two fingers to clean the tongue, and of course, other aids to clean the teeth and gums. So, actually, when we say oral health means a complete, hygiene and complete, sanitation of the mouth. And not just restricted to teeth and gums alone.
That's right. Yeah. That's right. So, Dr. Sunita, the basic question again I'll ask you is this, because basic cleaning is done with a brush, right? And you all always say that there is a technique of brushing correctly. Yeah. But in spite of knowing sometimes people in their busy schedules, don't really end up brushing the way they should. So, would you take this opportunity of just explaining very quickly as to what would be the right technique of brushing?
I think the objective of the first thing we should know is that what is the objective of brushing.
Correct.
Because we all know that the tooth structure, basically it's not smooth. It has different kind of, it is high, it has
levels,
some levels as well,
yes.
It has some ditches, some depths and so forth. So it's very important to clean upon. And when we talk about the tooth structure, it's like we have adjacent two teeth as well. So it's not always the brush which cleans, it only cleans certain surfaces, but we need to use some aids as well, for example dental floss. So what is recommended actually is that one should use a dental floss before brushing the teeth, specifically at bedtime. So after dinner, one should floss the teeth and then should be using the brush, which we normally it should basically involve all the areas while cleaning. So if I quickly tell you about this, is like, for example, dividing it upon 5 segments, 1, 2, 3, and of course we go on the inner side surface as well, on the palatal side here as well. So at least 7 to 8 strokes should be taken up while brushing the teeth in each segment. And taking into consideration the most commonest aspect which we normally tend to neglect is the inner surfaces or the lingual surfaces on the lower mandibular side, and the palatal surfaces, as Dr. Verma mentioned about it, to keep it as a healthy oral. And most important after brushing would be to clean the tongue. So the commonest complaint when we say that we have a fetid udder, like when somebody speaks and there's a lot of smell which comes. So it's very important to clean the tongue after brushing. And that should be done not with the tongue cleaner but with the
Yeah,
brush.
that's what I wanted to ask you, because you have so many tongue cleaners in the market. Dr. Kharbanda, would you like to say something about the tongue cleaners? Because some people will clean their tongue so vigorously that one could get scared. So what is the right way of cleaning the tongue?
See, to clean the tongue, what is important is that you could use the toothbrush itself in a gentle way, or you could use a tongue cleaner, but the one which is smooth on its edges should not be sharp. So anything of that sort will clean the tongue. The only thing is that after cleaning, a thorough rinsing is a must, because once you have taken out the debris from your tongue, it should be very thoroughly rinsed and cleaned. And one thing more here I wish to add is that when we talk of oral health of the mouth, its definition usually changes from infant to an aged person.
Correct.
So for a newborn, we want healthy gums. We want his baby teeth to come healthy. When he is in mixed dentition, we want that his teeth should come where they should be. They should not come haywire. When he is an adult, we want his perfect smile. When he is like 60 years, we want his smile to be good. And what we wish that he should be able to chew his teeth very well, chew the food very well with his teeth. And when a person is old, we still want that he should retain his teeth, and if he is not retaining his teeth due to some reason, he should have at least functioning enough number of teeth to function to give him good mastication.
That's right.
So that's how we go about it.
Right. So Dr. Mahesh Verma, if we talk of children, as he said, children who have milk teeth per se. So sometimes parents are not very serious about the hygiene and the care of the children, saying that, oh, these are as it is going to fall off and the child is going to get new teeth. So, and these children could also have caries and, the teeth could be decaying. So as a doctor, what is to be done for those children?
You see, I think it's very important. This is a kind of a myth which is felt by parents that, oh, these are milk teeth and they are not important. I think, like for any building, the foundation is most important.
Absolutely.
Similarly, I think these milk teeth, they lay the foundation for a healthy and a lifelong dentition. So firstly, we must understand that the first milk tooth which comes in the mouth is about 6 to 7 months, and they will last. They will keep cutting. The teeth will milk teeth will keep cutting till about 2.5 years, and they will last till about 9 to 10 years. So their lifespan is not just a couple of years. In fact, they have a fairly long lifespan, and in between something very interesting happens, and that is that at the age of 6 years, the first permanent tooth comes, which is behind the milk teeth.
Right.
See, so it creates a kind of a
milk
confusion.
Teeth start to fall, but you get these permanent.
Yeah, milk teeth have not fallen.
Okay, but
and
at
the
age
permanent
of 6,
tooth has already come.
Yes.
So now the milk teeth and the permanent tooth, permanent teeth, because there are 4 of them, they are coexisting. They are there. And again, there is a perception by the parents that, oh, this is a milk tooth, and that permanent tooth which comes at the age of 6 years is most likely to be attacked by the decay, and that's the most vital tooth. This is the most vital tooth in anybody's life, anybody's dentition, because losing that tooth can really collapse the whole dentition.
Absolutely.
So that is one aspect. The second aspect is that, you see, preserving the milk teeth is very important, because because they are actually below them are the permanent teeth are being nurtured. So, if unless we hold them in place for extended time, the permanent teeth might go haywire. And another thing is that, see, also it's very important to understand that the milk teeth have to shed at the right time, neither extended nor early. So, neither they have to be there for too long a time.
Right.
Because if they have too long a time, then the permanent teeth can go haywire, they can come here and there, and if they shed early, that also can create a problem for the permanent teeth.
But this is something that can't be checked, or can it?
No, it can be checked.
It
can be checked, and that's why we suggest that the baby should be examined by the dentist,
right?
If not a pediatric dentist, but at least by a dentist. And I'm sure they can look into it, and not only that. And then, as Dr. Kharbanda said, see, not just teeth, because those milk teeth are very likely that they would be affected by decay. There could be gum problems. So, all those problems which are likely to happen in the permanent teeth, start right there. So, we need to take care of them and ensure that everything uneventful happens, and so that our permanent teeth, which starts coming at the age of 6 years and till about 12 years, everything falls in place. And of course, the last tooth comes at the age of 17, 18 till about 21, 22 years, which we call wisdom tooth.
Right.
So, most of the permanent teeth have come at the age of 12, by 12. So, between 7 months and say about 11 years, we have milk teeth as well as permanent teeth coexisting.
Well, I think that's really very beautifully explained. So, for all the parents who are watching, please understand that your child's teeth are also very important. Don't just wait for them to fall and the new teeth to come, because as he said, it could be the foundation for the other teeth to actually come out. Well, folks, time for us to slip into a break. When we come back, we are going to take this discussion forward. Do stay with us. Welcome back. This is Healthy India, and today we are talking about oral health. Dr. Sunita, let me just ask you something which is very commonly found. You find a lot of people who have bad breath, and somehow they won't even know that this could be checked or it cannot be checked, and they keep going on where they're trying different toothpastes, and that's about it. But now, as a doctor, what would you suggest? First of all, why is it that certain people have bad breath?
It's a very valid question, and I think it's very commonly encountered condition which we come across.
Right.
I mean, we know more than 90% of the people, they have the periodontal problems, because as Professor Verma mentioned about it, we don't take into consideration the importance of the deciduous teeth, or maybe and subsequent to the permanent teeth. So we do not visit the dentist regularly, maybe, to get our cleanings done. For children, maybe to get some fluoride applications done, or maybe some varnishing done, and things like that, you know, which is a preventive aspect of dentistry. So what happens is that over the period of time, there are a lot of, because tooth is something like, you have a tree and you have mud around to support the roots. So we have the gums around, but it has a little space where those bacteria and all, they tend to lodge in. So if you do not rinse your mouth regularly, you do not brush your teeth regularly, and you not visit the dentist regularly, this deposit seeps into down in that particular, between the roots and the mud itself, and then they create a periodontal problem, what we call it as, to begin with. It starts wherein you just get a little bleeding gums.
Right.
So it gives you a signal. Fine, now you should be going and visiting a dentist, you know. But still we ignore, theek ho jayega. Maybe you start using some manjan, ki unka manjan acha hai, unka acha hai, and things like that. And thereafter what happens is, as further there's a deterioration which happens, we call it as a pyorrhea or a periodontal problem. So that is one of the very commonest cause to have the bad breath, because there's a lot of bacteria which, it's like getting decayed around, and it induces the smell there, decomposition of it which happens. Secondly, as I mentioned earlier, is not cleaning the tongue regularly, not rinsing the mouth, thereafter thoroughly. The third commonest reason what we can come across is that a lot of patients these days have diabetes. So these are the patients who have, uncontrolled maybe diabetes, which also predisposes not only to the gum problem, but it also induces dryness in the mouth. And dryness could be of many reasons, because of many reasons. For example, if you have hypertension, you are on antihypertensive drugs, you are on any kind of antidepressants, you are on any kind of medicines for rheumatoid or rheumatic problems. So there are a lot of drugs which also induces a side effect of having, dry mouth, which in turn also induces a bad breath. So, it should, the bottom line is that it should not be ignored upon.
That's right. That's right.
One should really, taking into consideration, visit a dentist, and then accordingly probably the dentist would, recommend as to how to
according
go
to the,
as to how it can be controlled upon.
Right. Now, Dr. Kharbanda, another thing that you all, I'm sure, must be noticing is dental caries. Many people would have cavities and not really think much about it, and they would just let it be, or sometimes maybe go for a filling, but if it comes off, then again they'll just let it lie. So why do these dental caries occur, and can they be arrested at any point?
Yes, I think this is a worldwide problem, dental caries. And it affects all civilized people, and even now animals. Now even animals are getting infected with caries because their food habits are getting more civilized. So they are not eating what they should be eating in a natural way. So same thing. So humans have been affected most. Now the dental caries in very young children, I will start from there, which we call it early childhood caries, and usually we call it ECC. This usually happens when the mother is leaving a water bottle or milk bottle which has lot of sweet in it in the baby's mouth while he is sleeping.
Correct.
So a lot of sugar and sweet and the milk is around the teeth, and this will obviously cause decay, because when the sugar is there, the bacteria and sugar make acids. Acids would dissolve the tooth, and this type of caries would affect usually those areas, maybe front teeth most, where usually which are not affected. Usually we get cavities in the molars first. And now these are the children who really suffer. They suffer, they get abscess, they get fever, they get pain, and sometimes the child is crying and you don't know why he is crying, and then you come to know, well, he has got a cavity in the tooth, front tooth, and that is the reason of his fever and pain. And I also wish to tell you that in many situations, from my experience with the hospital situations, that when there are many children who have other diseases, like they have a hole in the heart, and they need to undergo a surgery, they cannot undergo a surgery because they have infected tooth in the mouth. So we have to treat the infected tooth first. So it's very grave situation in children with the baby teeth itself. When there are mixed dentition, like Dr. Verma said, that at 6 years we get a first molar in the mouth, and we expect this is the molar tooth which is used for chewing all your life, and this gets affected again because of the habits which we have in terms of soft drinks, particularly the drinks which we think is very transparent, it will be nice, but its pH is very low, they are acidic. All fruit juices are highly acidic, all bottled juices are acidic, or colas are highly acidic. They have orthophosphoric acid or similar kind of things which makes them acidic. And when the acid remains in contact with enamel, which is essentially a calcium salt, they dissolve, and that causes cavity again. And of course, if we want to avoid it, the first thing is we have to minimize or restrict the use of all sweet foods and sticky foods, particularly the chocolates and the all kind of ice creams and the sticky cakes and all these, but obviously want to eat. So, the option is that you must rinse immediately after this, or you have to brush after this. So, that is how the problem of cavities is there.
Right. Now, Dr. Mahesh, another thing I think which I should have asked first was, the formation of plaque, tartar, or, and again sometimes this can go unnoticed also for certain people. They may not know really what is happening. But can this also get out of hand sometimes?
Oh yes, it usually gets out of hand.
Oh, it does. Okay.
Yes.
Okay.
And see, plaque, you see, there are many things. It's just plaque is invisible.
Right.
If it is lying on the surface of the tooth, we can't really see it. And that's why many a times in olden time we were using some dyes to disclose it, where is it lying.
Okay, okay.
And that's also, patient is not aware, or even some of us, while we are doing hygiene, we are not aware where is the plaque lying. And so we use disclosing solutions. And what happens that whatever, even howsoever hard we have taken care to maintain a hygiene, the plaque will form immediately after you consumed any food, So, this is inevitable.
Right.
This is there all the time.
You can't avoid it.
Yeah.
Yes.
And the problem is that the plaque changes, it slowly grows in terms of its texture, in terms of its content, in terms of the toxins which are produced by the bacteria which are enshrined in it, and then also slowly, because mouth, it gets calcified slowly, and as something which is soft becomes semi-soft, and then it becomes fairly hard, and it also has a tendency to stick to the tooth. There are certain forces which tries to see plaque is invisible, but it very tenaciously holds to the tooth. It has some attraction, it has some force which is it gets held on to the tooth, and this is the cause of all dental problems.
Right.
Whether it is decay or it is gum diseases, that is where the initiation of, that's why we emphasize all the time hygiene, maintain hygiene, because the prevention, in order to prevent it, if we get rid of it, obviously we do not end up having a dental problem, because that is the cause and effect. Cause is this, and it gets out of hand, certainly, because when it keeps on accumulating and we are not aware of it. See, most of us, we don't know. We're not aware. As you just talked about bad smell, the foul smell. Many of us, it is there, but we are not aware of it.
Yes.
So, it's there all the time, and then what happens? It keeps on irritating the gums, and anything which is irritating will bring about more blood supply. We call it inflammation. It becomes red, then it gets established there, then it keep on irritating the bone, then all that vicious cycle, and slowly gums start receding. Because you see what happens, this is not which happens in a day or two, it happens in years, over the years.
Yes.
And slowly there is a bone loss, the gums recede, the teeth become shaky or teeth get decayed, and slowly the end point is we lose the teeth, or the teeth get severely decayed. So, the carry home message is the prevention is the answer. Once it is there, it has already caused some damage, some little damage, which we cannot even assess. So, the best thing is, it will happen, it is inevitable, and we have to go all out forces, we have to put all our efforts so that we do not let it build up.
Right.
We eliminate it at the right time, and that is why we said we should go and go to a dentist and get a professional hygiene done, cleaning done, because it will be there, and only a professional can really remove
Identify and
it.
remove
Howsoever hard brush, or
Absolutely.
howsoever whatever floss or whatever you might do, you will not be able to get rid of it.
Well, folks, so the bottom line is that you actually need to visit the nearest dentist at least once a year, if not twice, because as Dr. Mahesh said, these are some things which are inevitable and which may not even be visible to you. So, best is to go to the doctor and let him or her decide. Well, time for us to slip into yet another break, but we are coming back very quickly. Do stay tuned. Welcome back. This is Healthy India, and today we are talking about oral health. We've spoken about how children can be taken care of, what happens when plaque gets built up, what are dental caries, how that can be tackled. Now I'm going to ask you, Dr. Sunita, that again, you know, if inflamed gums sometimes will lead to a lot of bleeding and bad smell and all that, and this is a condition which is somehow very difficult to kind of arrest by the person himself or herself. So what is it that should be done?
Lotte, it's like, you know, we talked about until now as to the role of, you know, hygiene. So I think the ideal thing is that prevention is the best cure.
That's
what
right.
Professor
Right.
Verma will probably
Right.
again reiterate to what he's mentioned about it. And what we normally do is, for example, we start from the childhood, inculcating the habits. So children, they always follow what the adults will do. So I mean, brushing in front of them, you know.
Yes.
And then when they're taking the tiffins at schools, so putting a small piece of maybe, you know, an apple or
That's
something,
right.
so that they
Right.
can just, you know, eat thereafter.
Yes.
Something fibrous. And also they say that, you know, there are a lot of studies which says that if you make the child eat little cheese, that prevents the plaque formation, it you know, delays it out
okay.
as well.
Okay.
So it's the objective is to bring the pH level so that it's not, you know, affecting the tooth structure. And once the pyorrhea or the inflamed gums happen, it could be because of many reasons. The commonest, of course, is that to have is the pyorrhea. The other condition could also be because if a pregnant woman, for example, so she can also have, you know, some hormonal changes happening at the same time, and that can also induce some gum problem. There are certain conditions, we call it as a precancerous conditions. And for example, lichen planus, so that can also, you know, have something which is an inflamed gums. We talked about diabetes, for example, some systemic conditions having effect, you know. And the other reason could also be if it's very localized, it could be because of, you know, if, something which is constantly irritating. I mean, you have a nail in a, in a chappal or a shoe, and it keeps on irritating.
Correct.
So it will induce a little, you know, ulceration kind of thing there. So similarly, you know, which is not a proper fit of appliance, which has been constantly irritating in that area, will also induce a little, you know, inflammation or a redness in that area. So it's important to go upon, you know, what is the reason to it, and then go with the treatment, because if it is something which is constantly irritating, it needs to be adjusted by the prosthodontist, or maybe if it is a gum problem, visit a specialist, where we have, you know, not only the cleaning, we have the, you know, now we go beneath, we open the gums, we clean the surfaces, which we call it as a flap surgery. and then again we resuture it out.
Okay, okay.
So, you know, that remains. Further down, we have many now the advancements. We have the periodontal membranes, so which we put it in between the tooth structure and the gum, and again it helps in the regeneration. It's like, you know, you're building up the wall and putting some acoustic material in between so that we don't hear the noise from outside. So it's something on those lines that you're trying to have different kind of, you know, possibilities. So I think it's important that it should be taken care for, because it should not happen that we're missing on, for example, leukemias. That can also manifest as bleeding gums, for example, to begin with, or maybe a dengue fever. Post to that, where platelet counts reduces, which is so common these days. So it should be diagnosed well in time, and then
yes. Dr. Kharbanda, would you like to add anything on to that?
Yeah, what I wish to add here is that in terms of halitosis, if you have halitosis, it could be due to mouth. Most of the reasons are because of pyria, but also because of diseases in the lungs. Certain lungs diseases can also cause halitosis. Sinusitis is also contributes to halitosis. So, if your halitosis is not going away after an optimization of the oral health, please look for something else, or maybe at the same time. Maybe at the same time. So, that is important. And in terms of oral cavity, like if there is an ulcer in the mouth which is not healing up maybe in a week's time, and it's constantly there, there is a reason to be alert. It may require further investigation, and usually we like to do a biopsy and see if it is a ulcer which is just an ulcer, or it could be turning into some kind of cancer. So that is important. And if there is an evident cause in the mouth which has been already highlighted, but a sharp tooth, for example, a tooth which is broken and its root is there, it becomes sharp, it causes ulcer, and that ulcer can convert into an oral cancer. Or there is a sharp tooth because of the grinding of teeth. So some people have the habit of grinding, and their teeth becomes flat and their edges become very sharp. They also cause irritation. So in the mouth there should be no irritation. And if there is an irritation, there is an ulcer, or ulcer even without irritation could also be need to be investigated. So anything unusual in the mouth, white or red, should be consulted by a specialist, and that could go a long way to save you from some dreaded diseases. I would like to say that.
That's right. Now, Dr. Mahesh, talking of cancer, you know, we have a lot of our population who is like addicted to chewing some kind of tobacco and all that. So now these people, I'm sure, at a much greater risk of developing oral cancers. So and so much so that I'm told that there are even certain toothpastes which have these flavors of tobaccos, and they also can be, I'm sure, pretty harmful. So what would you like to tell that population today?
You know, see, you know, the cause of cancer, of course, there are different types of cancers.
Right.
And some cancers are not so harmful. Some cancers are what we call malignant, are really harmful and can be life-threatening. And also another thing I also like to say here, that you know, one should not be very you know, suppose somebody has got a cancer, of course this is something serious, but also not lose hope.
That's right.
Also, because that's very important. I think reassurance and I mean, because there's so much advancement has happened that you know, many of the cancers have a you know, after it has been treated, has a good life after that. See, we are talking about oral cancer. We're talking mainly cancer of the mouth, and cancer of the mouth is very widely prevalent, and it forms a, you know, huge percentage of the cancers detected in the body. And more so, especially in this part of the world, these oral cancers are seen more. And of course, there are so many causes of cancers.
Absolutely.
But the commoner causes are like tobacco, and all these, you know, all those tobacco in any form, whether tobacco, chewing tobacco, smoking tobacco, tobacco in the form of a jarda, pan, pan masala, or snuff, naswar, you know, all those, there are many forms of tobacco. Ultimately, this is tobacco which goes into the bloodstream and which gives a kick, and which can bring about, which is a carcinogen. So that is one. And secondly, then there are other causes like alcohol, you know, all that, you know, other, some sepsis, some syphilis, and all these are traditional spices, You know, some people have a very spicy food, also it is supposed to be, so it can contribute also.
Right.
So there are many reasons, but predominantly it is tobacco and alcohol related. Now, oral cancer also, because why we are talking in this part of the world, because we in Indian population or in you know, Southeast Asia, people consume pan and they have these pernicious habits,
Yes.
which you know, where they consume tobacco, so they're more likely, and they hold the tobacco in mouth for a long time. The tissues change, and those tissues can turn malignant. But you know, there's something positive also, that you know, these oral cancer, before they turn malignant, of course many a time they turn malignant and we are not able to detect it, but many a times there are certain conditions which occur before they turn malignant,
Right.
and we call them pre-malignant,
Okay,
just before malignant.
right.
And I think it's very important for you know, the viewers to know that any white patch which is fairly big, you know, white patch, any red patch, any patch which has got ulcer in it, any ulcer which has suddenly become big, any ulcer which has become, and most of these ulcers are painless. See, people think, oh, it's not paining,
Right.
so it's nothing very
Nothing
dicey.
serious, yes.
So anything which is painless, so initially it is painless, and it's only when turned malignant, it increases in size, it has ulceration, it can involve nerves, it can there can be a palsy, there can many things. Of course, that happens after much longer time. So these are some of the signs, and if there is any ulcer, as Dr. Kharbanda said, any ulcer not healing, be alert, and must be. And then, you know, see, many a time you are not able to look into your mouth yourself. I think that's where we need a professional help.
That's right.
Need to go get yourself examined. You know, if you have a slightest doubt, you know, and I think Dr. Kharbanda is wanting to say something. Would you like to add, Dr. Kharbanda?
Yeah, I want to add here that in the oral cavity, beside tobacco, non-tobacco product also cause cancer,
Cancers,
and which sometimes we think are safe, like betel nut is traditionally used in our families for all auspicious reasons. But if somebody is a constant betel nut chewer, it has been proven that this also causes
You mean
cancer.
supari, chali?
Supari,
Chali.
and a slake
especially
lime,
the mixture
Right.
of supari and the katha and the
lime.
tuna, the squid is very dangerous.
Right.
So it is not just tobacco. So non-tobacco products are equally dangerous, and the India is like, or this part of the world is capital of the oral cancer because
Yes.
of these habits which we
That's
have.
right.
And another thing which I wish to add here is that there are some mouths which are absolutely clean. They don't smoke, they don't eat anything, something like this, and still they get a cancer in the mouth. And these cancers are of viral in origin.
Yes.
And these cancers which are viral of origin are more common in West because they use more unnatural sex. So this unnatural sex, using oral sex, is also a cause of cancer through viral origin. That is also important for us to know.
And also
Yes.
about that, a lot of females especially now, they're anemic. So anemia is also one of the precipitating cause because it does that, but they have less of hemoglobin content, and so any irritating factors, it really induces, precipitates out. So it's like you fall from 3rd floor, you fall from 7th floor, but then at the end of it,
I think
Yeah.
in our villages, nutrition is a big factor,
Yes.
and we
So-
always seen
Absolutely.
people who have nutritionally deficient.
They're
They're more likely to develop and
it. So-
convert a benign cancer into a malignant cancer. So you see, so nutrition. See, that's why we emphasize balanced diet, because
Absolutely.
and using fruits, using vegetable. Because some of these people in the rural areas, they have no access
They have no
to these
access. That's
because
right.
they are good things.
Correct.
They take care of. So these things also are very good to to prevent from the cancer.
Right. Well, so many things coming up today when we are talking about oral health. I hope people, you are following everything that is being said, and these are some things that can be practiced so that you can really take care of your oral cavities. Well, time for us to slip into one more break here in the program, but we are coming back very quickly, and when I'm back, I'm going to take this discussion forward. So just stay tuned. Welcome back. This is Healthy India, and today we are talking about oral health. Dr. Sunita, now I would want you to tell us, about the fact that sometimes people may have injuries on their mouths, or due to an accident, the teeth can just fall off and all that. Now, when something like that happens, can these teeth be preserved?
Yeah. Okay. I think it's very important because we feel that there's an injury and मतलब अगर दांत निकल गया तो it's like over now, nothing to, we cannot do anything. But I think it's very important to know that the moment the tooth gets, injuries could be of different types. And it could be, impacting upon the different age groups. But the commonest ones are like those 8, 9, 10 years. Or maybe, students are playing crickets and things like that. Or maybe there's a fall or something. So it depends upon what kind of injury it is. But the valid question that you posed upon, that suddenly there's a tooth which gets exfoliated. So the best thing is that either to put that tooth in a saliva of the patient or take a milk. Preserve that tooth. Don't try to clean it. Don't wipe it with a tissue paper. Don't, take any kind of handkerchief to clean it. Just put it in that and stop the bleeding. Where it is bleeding upon, maybe put a tight cotton or a gauze or something which is clean cloth there. Stop the bleeding and reach the nearest dentist. So what we can do is within that period of time, still the tooth doesn't get fixed with the bone in the in the socket, or where it's a bone and the tooth, so it doesn't get just fixed with the bone. There are a lot of ligaments around. So it's like, you have layers in between. So if that layers are still vital, we can surely implant it, and then we can do little wiring around, stabilize that tooth, and then again the blood circulation we try to, so it's like, replanting a small, plant again in a new kind of ways. So that really helps in those lines. And of course, we also advise not to bite and things like that as the precautions that we advise upon it. But having said that, if there is an injury which has, which is slightly longer in duration now, maybe it's like a week or 10 days. So depending upon what structure has, broken upon, and we try to assess it out with X-rays or maybe vitalometers. And then either we'd go for a root canal treatment for these teeth, or maybe we would just wait for a while and see the dentist would assess upon it. But we have a provision to give some kind of, aesthetic restorations or aesthetic fillings, in terms that the tooth colored fillings could be done for the broken part which has been there. We can give some kind of, cappings and things like that on it. So just to, to enhance the aesthetics, and should not feel bad about it. Ki toot gaya to ab kya hoga? It's not the end of the world about it. But the most important aspect, I would say, with any of these kind of sports that you're playing, for example, try to get some kind of, maybe a mouth guard made. So it's the best thing to prevent. अगर आप सॉकर बहुत ज़्यादा खेल रहे हैं, आप क्रिकेट में हैं, अकेडमीज में हैं, तो एक बार जाकर अपना one should get a little mouth guards made. So
right. Now, Dr. Kharbanda, these days we see a lot of people, particularly teenagers, when it's time to get their crooked teeth really in shape.
That's right.
So now, what is the advancement on that? Tell me, how long does it take, and what is the process?
You see, if you just would ask me the data, then about 40% children in the age of 10 to 14 need some kind of treatment.
Right.
Of which 10% are the serious enough to which should be treated. Now, usually there are 3 or 4 problems. One problem is teeth are uneven. So everybody wants a very nice teeth.
That's right.
The second problem is their bite is not right. Either bite is too deep or too open. They don't meet properly. That is the second thing. Third thing is either teeth are too far forward, top teeth, or they are too far inward.
Right.
Now, this is like you can say the putting of braces, the planning requires like an architecture planning, that there is some building which is haphazard.
Right.
And you want to make a very nice set out of, you carve out a very beautiful building out of that. And that is what it requires. So the traditional way what we do is we have very advanced kind of a system which appears a piece of metal, but it is not. It has a very intricate mechanics in it.
Okay.
And we have very advanced kind of wires. One of them is nickel titanium, TMA, or even more advanced. And these wires gently push the teeth to be in the alignment. Now, many people are scared that when you want to align the teeth, usually the orthodontist would say that you need to take out 4 teeth,
Right,
side
right,
ones, and then
right.
only he can fix it. But not all cases. But these days now there is a technique by which we need not to extract.
Okay.
So
okay.
don't be scared of going to an orthodontist that he will extract. The second thing is that now treatment is much faster. It is painless. And the other thing is that the outcome is much better than before. The third advancement is that now many adults, like sometimes it has happened that I have treated a young girl and then mother is asking me,
That's
can
right.
I also fix my
That's
teeth?
what I wanted to ask, because
Yes.
usually people think that this can be done only in one's, say adolescence and all
Yeah,
that.
yeah,
So
yeah,
can
that's right.
adults also get their teeth?
Yeah,
Is that
it
right?
has happened many times
Okay.
that we have done a girl and she comes out a very beautiful girl and mother also wants to look the same. And yes, that is possible. And now adult orthodontics is a way out and way in now. It is in and out. And the other thing is that for adults now we have clear braces so that they can wear transparent braces and which are not visible at all.
That's right.
They are
right.
not visible. So it doesn't affect their social engagements. And yes, it does help to gain them like better self-esteem,
Absolutely.
which they could not do when they were young, but they can still
They can still do
still
it.
do it.
Absolutely.
Yeah, that's
absolutely.
right. Yeah.
So now, Dr. Mahesh, what are going to be your final comments in the show today?
Final comment, carry home message.
Right.
As usual. I think 6 or 7 things.
Okay.
One is most basic, swish, rinse, brush, floss, prevent, visit, and be gentle. I think these is in order. One is swish, because the least we can do is after we had our food, rinse our mouth.
That
Because
can be
we
done
love to
anywhere.
have our food, we have
Oh,
a
yes.
sandwich in the morning,
Right.
and we want to linger on the taste. I think, but you have to get rid of that
Yes,
taste.
yes.
Please go, if you can't brush, at least vigorously rinse.
Rinse.
Take out all the food debris. That's the first thing. Swish more often. When you're in the office, you've had a coffee, may go to this thing and just swish. Then of course brush. Brushing twice, be gentle, kind, soft brush, use a good toothpaste, clean all over, not just up front.
That's right.
Backside, inside,
right.
clean your tongue, clean your palate, and and then floss. Okay, floss first, clean after. Floss first, and then you can clean. Then of course is prevent. Prevent means prevent from injury, do preventive measures, whatever
Right,
possible.
right.
Then visit dentist,
I think
once
that's
in 6
crucial.
months or once, and then be gentle. Don't gamble with your teeth.
Absolutely.
Because
Don't open
most people think
beer
that
bottles
your
or-
teeth are hard. We
Right.
we open bottles and
Bottles.
we do all kind of things with
Right.
teeth. Teeth are to be taken care of. They are precious gems. They have to be nurtured and admired and
That is
so
true.
that's it.
Yes, Dr. Sunita, what would you like to say at the end?
I think I would emphasize also upon to have a nice nutritious diet and a balanced diet along with maybe even if it is not a high iron contents, but have something which any fruit which you cut and it becomes darker in color and so food of those kinds. I would strongly recommend upon it. Avoid having alcohol and cigarettes or
Tobacco in any form.
tobacco in any form.
That's right.
Chewing or smokeless tobacco should be avoided upon.
Absolutely.
Yeah.
Yes, Dr. Kharbanda, final remarks.
Moderation. Moderation in life
Right.
and moderation with the teeth. The only thing I would say is that don't insult the teeth with those foods which attack them too much,
Right.
because all other things have been said already.
Right, right.
And early detection.
That's again very important.
Early detection and early management. Yes.
Absolutely. Well, on that note, I'd like to say thank you to 3 of you for coming
you.
today and for explaining everything so beautifully and in such detail. So thanks a lot.
Most welcome.
So, well, folks, I would want now I would like to leave my address for you so that you can write into me and tell me as to what more you'd like to see on Healthy India. Any kind of feedback is also welcome. So please note this address.
FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com. And our toll-free number is 1800-115314.
And now at the end, I would just like to say that teeth are precious, and as Dr. Mahesh Verma said, they are gems. Now, this is something that has to last a life for us. So, we really need to take care of them. And as all of them here said, take care of the hygiene, take care of the diet that you eat. Do not insult your teeth, as Dr. Kharbanda said. And also, please remember that if there's anything unnatural that you find, whether it is a tooth that is protruding and pushing somewhere and you're getting some kind of an ulcer, it's time for you to go and visit the doctor. Or if there's bleeding gums, or if your mouth is smelling bad, anything that you think is unnatural and is not feeling right, I think that's the time to go and visit your dentist. And not only that, a yearly visit, if not a 6-monthly visit, is a must, because for all you know, as I said earlier, a lot many diseases could be picked up by the condition of your oral cavity. So this is something that has to be taken care of very seriously right from the time when you are little children. So do take care of the children that you have at home, and also the old people that you have at home, because these are the two extremes that really need to be taken care of. And as I said, if you need a pearly white smile, you really need to take care of those precious pearls of yours. Thank you so much for watching. Catch me next week when I'll be taking up another health condition on Healthy India. Till then, this is Lottie Alaric saying goodbye and take very good care of yourselves.